Well, with the stem cell facelift, what I'm going to do is the following. I'm going to do some markings here on his face, but the objective of the treatment is basically to cause a natural facelift, basically giving volume to the mid part of the face, as well as to the nasolabial folds. Basically, you will be able to see it right now. So, we're going to enhance this. Basically, this would be the main components in his case, making some anatomic landmarks here. Okay. As you could see, these areas are very pronounced. This is due to the aging process. So what we're going to do also, besides doing the stem cell facelift, we are going to put some stem cell also around all these areas right here under the eye and right here also. And then we're going to apply some stem cells also along all these lines around here. Okay. And then after we do the mixture with the stem cells and the fat, then after we're going to basically apply stem cells under the skin also. Basically, what I'm going to be doing is a very tiny hole in here. I don't even use any knife or anything. That's what I'm saying, that the recovery time is very fast. Basically, it's a procedure that the patient is going to start seeing improvement day by day, week by week. So that's basically what we're going to be doing at this point in time. As you could see, actually, Joe has a good muscle development due to exercise, and also he has very small percentage of fat. Actually, this is going to sound funny, but before this procedure, I had to put him to gain weight. He actually gained 14 pounds. The reason being because I need fat to have the fat removed and also to be used on the face, as well as we need fat also to, of course, doing the removal of the stem cell here in the clinic in our lab. Something important to mention too is that the technique that I'm going to be using to remove his fat, to use the mini liposuction, is what is called the water-assisted liposuction, which is a technique from Germany. The reason I like to use that one, especially when I'm going to be doing fat transfer into the face, into the breast, or into the buttocks, is because the fat that comes out is a pure fat. It's very, actually very yellow, and rarely you will see any blood at all. So that's something important actually in the technique too, because that's what we want. We wanted a fat that is a viable grafting technique actually.
My name is Joe, and for all of my life I've been active. I've been an athlete of sorts. I've been a skier, runner. I've been exercising ever since I can remember, I think since I was 17 years old. I'm now 64. And one of the reasons that I'm particularly interested in the stem cell process is I've read a lot about nutrition. I've watched my diet for years. I've exercised for years. And this is another way for me to stay young, stay active, and really make the kind of difference that I want to make with a young body so that my mind can follow.